everybody.
Good afternoon.
Thank you for coming. I love that you showed up. And today is the 11th talk of the year. So I've been doing this once a month since January. And all of the talks are archived on my website, which FYI is bestmedicine.us. And you know, it's not Canada, it's not Mexico, it's US. So that's just how you remember it. And it's under education, I believe. They're all there. You don't have to watch them, but you can have them on while you're doing other things, because the listening is the important part. So what I tried to do was to take a tour through the body, starting with the overview, and then cognitive function, heart health, and mental health, and whatever. I don't even remember what we talked about. But today is the 11th talk, and it's going to be about something pretty new to me, which I'm very excited about, which is a new tool in my toolbox. It's called peptides. So for those of you who aren't chemists, let me explain what is a peptide. So you know what amino acids are, correct? They're small molecules with a nitrogen. They always have a nitrogen in them. And they are the building blocks of protein. So proteins make up everything in the body. Enzymes, they're structural components, they're messenger molecules, they're everything. And they're very unique in their job. Peptides are just little portions of proteins. There may be three amino acids long, or could be maybe 8 or 10 long. They're not big. Proteins can be hundreds of amino acids long, and they get folded up on top of each of themselves and intertwined with others. They're extremely complex. But peptides are pretty simple. And they fall under the category of what I consider messenger molecules. So how does the body communicate with itself? So here's my first very off the wall kind of concept. And that is, we are not simply chemistry. We're not bags of chemicals walking around. We are chemistry and physics and consciousness. So we're getting metaphysical already, but this is the place, right? And you guys came not just for a lecture on chemistry, but really for my whole philosophy. You're going to get it, like it or not. So in my world, matter exists. And matter and energy, as Einstein taught us, are interchangeable, right? E equals mc squared. But there's a missing component that Einstein never got to. To me, the ground substance of the universe is not energy, it's consciousness. So if the universe is conscious, then that conscious intention kind of condenses energy out of the nothing. And that energy then condenses into matter. And so we have matter and energy and consciousness. So everything in my world is infused with consciousness. Not just our brains, but our clothing, our floors, our buildings, our trees, for sure, the ecology of the planet and everything in it is one big consciousness. So that's totally off topic, but I thought I'd throw that out to you and let you chew on that for a while. So I'll entertain questions at any point. This is not a long lecture. It's not intended to be, and it's really intended to be a give and take, a dialogue, a question and answer. At the end, I'm going to have questions for you. So not like a quiz, don't worry. Not be a quiz today, maybe next week. Okay, so peptides, probably the most famous peptide, and the first one that was, it's a polypeptide. is insulin. And these scientists Banting and Best back in about, I believe, 1913 or so, won the Nobel Prize for discovering insulin. So we all know what insulin does. It's the primary way that glucose gets into the cell. If you don't have enough, or if your cells are deaf to that message, you'll become diabetic. So peptides are health promoting in the correct doses in the right person. So another example of a peptide is the famous, now infamous Ozempic. So we all know about that and what a stir it caused in the medical world, because Ozempic helps you lose weight and you don't really have to do anything to make that happen. So just shoot yourself up once a week and your interest in food goes away. And in many cases, sadly, your gut stops working, but small price to pay to lose a few pounds. Not so. Peptides used correctly in the right dosage should not have side effects. But the drug company has patented not the peptide because it's natural and you can't patent a natural substance in this country anyway. Well, they find ways. They have patented the injection device. So the injection device is preloaded with a dose. And that dose is the same whether you're a 90-pound, 80-year-old grandma or, a 300-pound linebacker. It's the same dose. So there's no customization. There's no personalization. There's no back and forth. You go to your doctor, you get your prescription, and you take it, like it or not, whatever the consequences. So that isn't the way I like to work peptides. So that's why people have problems with Ozempic. So I heard a very brilliant naturopath, and she recommended that you start very low. What a concept. You can buy peptides off the internet. Of course, quality is primary, and you need to know who you're buying from and make sure that it is what you think it is. So I don't recommend that you do this on your own, but it is legal and you can do it on your own if you so desire. But I'm here to keep you safe, to make sure that it works for you without causing paralysis of your gut, inability to eat for the rest of your life. Anyway, so Ozempic is the big deal now. It's a peptide, it's called semaglutide or GLP-1. So GLP-1 is produced in the body, actually in the stomach lining, and it's a signal of satiety. It tells your brain you've had enough to eat. So if you're injecting it, the brain is constantly getting that message, and you kind of lose your interest in food. I'm sorry. Okay. So, did you guys hear what I said, or should I start?
Oh, that's much better, actually.
Thank you. Okay, I can hear me now. All right, so I consider these, like I said, a power tool, and I like to have a big toolbox. So I'm a doctor who many years ago realized that I didn't get what I needed from my medical school of training and residency training after, and all the torture that we had to go through, which now I realize was a kind of brainwashing. So when you're chronically sleep deprived and you're never eating correctly and you don't get to exercise and you're always under pressure and you're competitive and you're this and that, you wind up in the image of your torturers. So my torturers were very well respected professors, and they were making us into their own image. So this is how information is passed along, with a big dose of I don't want to say humility, because the humility is in you, but humiliation. the word I'm looking for. And, biologic stress. So it's very hard to go through med school. It shouldn't be that hard. Doctors who are sleep deprived don't make good decisions. So you don't want to be in a teaching hospital on July the 1st with a complicated problem, because you're going to get a guy who was a medical student yesterday who will see you first. And then if you're lucky, you'll get passed up the chain of command and maybe get to a doctor who has some experience. Anyway, that's not what I'm here to talk about. So the toolbox that I was given in med school and paid dearly for was drugs, surgery, radiation. I learned a lot about testing. I learned a lot about physiology in year one. Year one of medical school, you learn about normal. After that, it's all pathology. It's all illness. It's all take this constellation of symptoms and slap a label on it, which we call making a diagnosis. Once you've made a diagnosis, you've pigeonholed the human being into a short little letter and number code with which the doctor will get paid by your insurance company. So you become, the gallbladder in bed too. And, you kind of miss the forest for the trees, and you never really meet the human being around that gallbladder. Nor do you have time to, nor is there any incentive to. And that's the situation currently. So it took me 10 years. I became an ear, nose, throat surgeon. And I was a good one, and I enjoyed what I did, and I helped people. But I started having a weird feeling. Patients would come in and tell me, I saw this nutritionist, and now I don't have my gut problems anymore. And now I'm cured from my migraines, and now I don't have joint inflammation. I'm thinking, wait a minute, I don't know how to do that. I'm a doctor, I'm supposed to know everything, but I don't know that. I don't know anything about nutrition. We had 1 hour of nutrition, and it was basically the hospital nutritionist coming up to tell us that you don't give kidney patients protein. That was it. There was no discussion of vitamins, vitamin deficiencies, food quality, how to eat, how to live, none of that, none of that. So sadly, I realized my education was deficient, but I still was the proud owner of the magical degree, the MD. And so I could go out and keep learning. How about that? What a thought. Most doctors don't do that. They will learn in their silo. So they're body parts doctors. There's a lung doctor, knows everything about what can go wrong with the lung. Not how to support lung function, not how to restore lung function, but just if it goes wrong, this is what you do. So you do things. The more things you do, the more money you make. So it's a badly incentivized kind of a situation. I hope I'm not offending anybody here, but nobody's left yet. And I'm just speaking my truth as a doctor of, when did I get my MD? I got my MD in 1974. So you do the math. How much is that? 50 years ago. I'm not old enough, but I was 3 at the time. Okay, so what do we use these peptides for? Anyway, I was talking about my toolbox, and now peptides are coming into use in my world. And I love it because they're simple, they are relatively inexpensive. So the Ozempic that you go to the drugstore with a prescription for is going to cost you around and about $1,200 a month. A month. And remember, that molecule is not patented. It's the syringe that's patented. So you're paying like $500 a shot, just crazy. So I decided that I was going to learn more about it. And so I started using them on me. And lo and behold, they work. They work really well. And no side effects if I keep the dosing low. So I want to just bring you up to date on this power tool and then have a discussion with you about how we might roll it out in an affordable way. So, all right, so here, what are they used for? That's the main thing. I'm not going to go through a list of peptides. It's complicated. Each one has its pros and cons. That's not really something that I want to be teaching you. But I want to teach you what are they good for. So number one is energy. So as we get older, our mitochondria, the little energy factories in our cells, don't work as well for many reasons. They're damaged, their DNA isn't perfect anymore. They're full of heavy metals and plastics and toxins that clog them up, just kind of slow us down. So it's pretty obvious that most older people, at least in this culture, are slow and they're stiff. And it takes, I have one dear friend who I just watched him get worse and worse. And you just, we want to shake him and say, I can help you, I can help you. But some people don't want to know. Oh, I apologize for the photo I had enough. I wanted to get pictures of peptides and proteins and all that. And the website wanted me to subscribe. So I don't have pictures of proteins. I'll figure it out somehow. Susan will teach me how to get things for free off the internet. Meanwhile, we can look at some pretty pictures of Egyptian pyramids. So, all right, so energy and rejuvenation, because when you wake up your mitochondria, everything works better. Suddenly you can make new cells, your brain lights up, everything works better. So what a simple thing, what a nice thing to be able to get younger with each shot that you give yourself. Okay, so then what's the thing that we're most afraid of with aging? Most of us are afraid of losing our minds, losing our memory. Once it happens, it's really hard to roll it back, not impossible in some cases, but it's much easier to prevent things. Prevention beats rescue every time. So let's prevent cognitive decline. And there are a number of peptides that can do that, do it in different ways. So it's going to be fun to try this and try that. So we're going to have a peptide club and peptide parties. So the Ozempic one, of course, is the famous one for weight loss. And it really has revolutionized weight loss. I think it's great. If someone needs to lose weight and they don't know how, this will help. But again, in my world, the education has to go along with the therapy. If you're not learning how to maintain your weight loss, you haven't been done a real service. Then you're dependent on the shot, dependent on the doctor, and that's not what I want at all. I want empowerment for my patients. I want my patients cured, young and vibrant, and they're going to bring me more patients just for that reason. So most doctors will say, you don't want to cure your patients because then you lose a customer. But instead, they have the subscription model. You come in every 3 months, I'll give you a hormone pellet, and you only have to pay me $500 or whatever it is. I mean, it's ridiculous. So anyway, my goal is to empower with education. So while you're on the peptide, you're learning how to eat for your body. And that isn't the same for everybody. And it isn't the same for every stage in life. So it's always changing. So the first thing you need to know is body awareness. You need to cultivate listening for signals from your body. We in this culture, especially men, women are a lot better. We have to listen to our bodies, so we disgrace ourselves every month. And then we get in the habit. Oh, that little twitch. Oh, I know I'm going to get my period tomorrow. So we're tuned in much better. But, as far as foods and deciding what makes you feel good and not, that's another story. We do need to learn that and practice it all the time. So body awareness is hugely important. So while you're losing the weight, you're learning how to eat. And it has to be like a contract between us, because I'm not there to see what you're putting in your mouth. And if you want results, then you have to be honest with yourself. It's not up to me. I do what I do for me. And let me tell you this, I am not perfect. I'm very healthy. I always have been. And so I can get away with being good 80% of the time. 20%, we fudge a little, we have a little ice cream, we have a little whatever is the necessary evil of the day. So I'm not fanatical about it. I don't think that's helpful. I think that puts too much stress. If you're really sick, if your gut is really marginal and anything you put in it makes you sicker, then that's a different story. You have to be more meticulous. But then you need, even more so, you need someone to hold your hand and help you, guide you through testing and through trial and error and see what works for you. Anyway, so, okay. So what else are they good for? They're good for modulating inflammation. So inflammation is rubor, turgor, calor, and dolor. Redness, swelling, pain, and calor, and heat. So those are the four things that are the hallmarks of inflammation. Doesn't tell you why you're inflamed. You could have an infection. Okay, a pimple is an inflammation that is created around an invading bacteria. So the body is infinitely smart, and we don't want to be fighting symptoms that are there to help us. So when parents give little Johnny an aspirin because his temperature is 99 or 100 or 101 or 2, they're really not helping, because the body is doing that for a reason. And the reason is that those bugs die at a certain temperature, but little Johnny doesn't. So he gets a fever, he has a crazy night, you're up all night. And the next day he's fine because his body did what it was supposed to. So we are trained, if you have an aching knee, you must take something. And you could start with Tylenol, go to aspirin, and go to NSAIDs, and go to tramadol, and go to morphine in the end, or any kind of opiates, because pain, it shouldn't be tolerated. When actually pain is your body trying to get your attention. So if you listen and you learn and you find the root cause, the inflammation doesn't have to be there. So it's a whole different way of looking at health and illness. Remember, the body, I had a great professor, he was a kidney doctor, and he said something one day I never forgot. He said, the sickest kidney is smarter than the smartest doctor. Mm-hmm. And that made me so happy, because it wasn't all up to me to figure it out. If I gave the body what it needed, I took away the offending factor, the body would heal. So we all know that. You cut yourself. You don't know how to make fibroblasts come together and clots and all the stuff that has to happen in order for for that thing to heal, but a week or two later, you're just like nothing ever happened. And that is the wisdom of the body. So we need to respect our bodies more and work with the body rather than against it. So antibiotics, what does that mean? It means against life. Antidepressants, anti-anxiety, all this stuff is opposed to a symptom that's trying to tell you something. Okay, so modulating inflammation and rapid healing. There are peptides that do that. So then if you have an immune system that's been compromised, let's say you've had chemotherapy, chemo attacks the fastest growing cells. So that's why your hair falls out. That's why your gut gets wonky, your skin, and particularly your immune system. So tell me, what kind of sense does it make to disable your immune system when you're fighting cancer? None at all. Your immune system is smarter than your doctor. So if there can be a synergy where the doctor knows more than just poison to give you for cancer, hoping that the poison will kill the cancer before it kills you, and that doesn't always happen. These chemo drugs kill people. Radiation kills people and makes them miserable. Surgery is something else, to go through. Sometimes I agree with it. It gives the immune system less work to do. So, by the way, I have not thrown away my prescription pad. I'm not opposed to drugs. I just have them kind of lower on the list. This is the first thing I offer people. So, yes, so we can reboot the immune system the way the body did when you were a kid, and that is with thymus peptides. So the thymus gland sits under your breastbone, and it's very active in childhood. It teaches T cells and B cells what their jobs are. And the thymus atrophies over a lifetime. So none of us here in this room has a very active thymus at this point, but we can give peptides that teach your cells what to do. So if you're the kind of person who gets COVID every 2 weeks, and you're afraid to go out in public, and the next time you get a cold, you're going to die. This would be a good place to start. So magical, kinds of magic. So then tissue regeneration. So for example, most of us in this room have a couple of wrinkles that we didn't have 10 years ago. And some of these peptides can modulate them, can reverse fine lines and wrinkles, build collagen, get you better hair, get you better nails, and help with bone density, which is collagen dependent too, and help with muscle growth. So multiple factors, multiple benefits. So the one I tried this one in January, telomere lengthening. So the pidolon mimics a hormone that's put out by the pineal gland. So who knows about the pineal gland? Yes, good. You have a medical background?
No, I'm a nurse.
Yes, you do. Yes. Yes, I see you nodding your head all the time. So yeah. So the pineal looks like a tiny pine cone. And it's dead center in the middle of the brain. And it puts out, in addition to melatonin and DMT. So a little aside, DMT is a psychedelic active molecule. It's found in nature, in trees and plants, some of them. and in our brain. So my theory is we make DMT at night, and that's what gives us our dreams. Dreams are like psychedelic land, and psychedelic land is like dreamland. So we are actually doing that every single night. So if you think that, just say no to drugs, you probably ought to have your pineal removed. Because
Did you repeat those letters so that I can
DMT, dimethyl tryptamine, DMT. So, and then there are peptides that can reestablish your sleep pattern. We all know melatonin. I read about one and I've forgotten its name. They give them crazy names. Some of them have names that you can, remember, but others are just letters like CJC 500. Yeah.
Before you go on, can you go back to the pineal gland that's in the brain?
Yeah.
What is the relationship to that and peptides?
It makes peptides.
Oh, it makes peptides.
It makes
One of
peptides.
them is the DMT.
One of them is DMT, one of them is melatonin. It's not a peptide, but it's a signaling molecule. So, okay, I'm going to tell you another story. So you remember Descartes, the French philosopher, who said that the mind and the body are separate. And that was a big mistake. We're ready to relearn and rethink that one. But he thought that the mind and the body came together in the pineal gland. So he used the pineal for that purpose. In my cosmology, the soul is a tiny packet of energy, like a photon of light. And it travels around the universe. And when it wants to incarnate, it comes into a formative body through the soft spot in the top of the infant's head, finds the pineal gland, which has tiny crystals in it. And that photon shatters into the rainbow that becomes the human energy field, which then is the blueprint for building the body, for going through life. It's the energy, it's the physics of the body. So again, we're not just chemistry. So the pineal is very important, and every culture has some image of the pineal in its art. So you see on the top of some columns in Greece and Rome, these pine cone looking things. And that's what the pineal looks like, just like a pine cone. So cool stuff. Okay, shall I go on? All right, so healing, repair, we talked about that, skin, hair, connective tissue. So peptides are very versatile. We like to think that everything can be swallowed and it'll work for us. Unfortunately, that's not the case. Most peptides will be broken down by stomach acid into their component amino acids, and then they won't be reassembled the way you want them to. So in many cases, the best way to give a peptide is the way insulin is administered. A shot, a little tiny shot with a tiny needle that you barely even notice unless you work yourself up in advance, but you'll figure it out. It doesn't hurt. Or it can be given, some of them are given as nasal sprays. So some of the most cognitive enhancing ones, the brain enhancing peptides, can be given in the nasal spray because they go direct to the brain. So we have the olfactory nerve, the sniffer at the top of our nose, and that is actually part of the brain. The eyeball is part of the brain. I suppose you could put drops in your eye. And okay, what else? Some of them can be given orally as pills, and that's very nice and convenient. and others can be given as a topical cream. So it turns out the one that's best for the skin is best given in a cream form. So many of the cosmetics, the high-end cosmetics, are putting that peptide into their formulas now. So how cool is that? And this is the big question. Yes.
These peptides that you're talking about that come from different areas in our body, are the peptides all the same, or are they different when they come from a different, let's say, like amino? Is that peptide different than the one from this one, say, or the BPC 157?
Well, they're each one is different,
Okay.
but the pharma industry is very adept at taking natural substances and adding a little something to make it a little bit different. And so that one works a little bit differently than another one. So in the case of, for example, growth hormone is powerful. It's a rejuvenator, but it's also got a dark side. If you have a cancer somewhere, it can feed it and make it grow. So they've taken the growth hormone releasing hormone, okay, the pituitary makes these hormones that signal other glands to make what they make. So you may be familiar with thyroid stimulating hormone, or follicle stimulating hormone, or growth hormone releasing hormone. They take that and they change it a little bit. So one might be called samorelin, another one is ipamorelin, another is, all kinds of, they're slightly different one from the other. They have different characteristics, and it's just something that is part of the game to try to find the one that works best.
Okay, so this is what's confusing.
Yes.
Okay, these peptides that our body makes naturally diminishes, of course. And let's say that I want to have a peptide that would enhance my cognitive ability. I go online and I look up peptides and I buy a peptide. Will that peptide be the one that helps my cognitive ability? Or how do I know which peptide to get?
Well, you do the research. There are monographs on all of them. There are papers in PubMed. That's my job. That's what I do. And so I want to be the one to hold your hand. I would like to learn more about peptides, and I would like to do it kind of in a group format, because I think we learn best from each other. And women love to sit in circle and share and learn and be friends and, help each other. So you would be helping me if you offered yourself as a guinea pig. Okay, I mean, I don't like to think of it that way. I do feel they're very safe, and I certainly would never want to hurt anybody with that. But we can kind of do it all together. And so the point of this, or the last thing that I wanted to say, is that after the first of the year, let's get through the holidays and through all the madness and get to where we can breathe again. And then we can get together in groups once a week, get our peptide shot or get our peptides for the coming week, depending on the dosing and whatnot, and share our experiences around that and learn what to do to maintain our benefits without being dependent on the peptide. And I see myself, for example, doing one peptide for a few months and see what it does, and then move on to the next, or what they call stacking peptides and supplements for a certain purpose. And then rotating, because you don't want to do the same thing all the time. If you only do the the cognitive enhancement, you'll be a genius, but you won't be able to walk. So it's balance too. It's balance, it's knowing what you need, and it's exploring together. So I'm about to have a rate hike in January. I wanted to warn all of you, so if you want to make an appointment, do it between now and then. And you'll get the current rate, which is $400 an hour, one-on-one. And in that case, most of you, I would think, I would want to offer you hormone replacement first. So that's kind of the foundation. That's the basic. And then on top of that, the peptides like Christmas ornaments. Let's see what this one does. And let's try that one. Kind of do it together. I'm thinking of it as peptide parties. But I don't want to trivialize what we can accomplish with this, because I think we can really do good things for ourselves.
Are you ready for questions?
I'm ready for questions.
So we would then get our peptides through whatever company, through you and whatever company.
I'll make sure that we've got them correctly stored, and we'll keep them for you. Brittany, raise your hand. Brittany is my new nurse. I'm so excited. She's going to do the injections, and we'll soon be offering IV therapies too. So, and probably also thermography. So if you don't want to do mammograms every year, which I think is a crazy thing to do, who radiates the same body part year after year? Come get a thermogram.
So it sounds like they're tailored individually to a person's, or does everybody benefit from all of the peptides?
I don't know.
Or so it means, yeah.
I mean, clearly, if you don't
Sounds like
have
I
any,
need all of them.
no, you don't need all of them. And in fact, I'm thinking of creating a menu so that you can decide which category you're in. And then the pricing is different. Some of them are less than $100 for a full course of treatment. In fact, the semaglutide is about, I think, $150 instead of $1,500 a month. So you get $150 for a 6-week course. You can lose a lot of weight. You can benefit greatly from that. And if it's not done in 6 weeks, then you can keep coming and we keep giving you the peptide. So we can arrange for beyond the classes. But I like the idea of coming together in a group for 6 weeks. That's how long it takes to learn a new habit or to undo an old habit. So it'll be kind of like a support group. So, and I would love to see some younger women involved too. Eventually, I want to do pre-pregnancy cleanup classes, kind of thing. So, yes.
I want to make sure I understand that. So I know that pharmaceuticals they can't be natural substances. So they have to make some synthetic form. You were talking about how there's the natural substances of the peptides. I know that peptides are just broken down sequences of proteins. And I know that he always, when she would use a targeted therapy of supplements, they would be to push open certain pathways or to jumpstart certain things or to work around something that wasn't working. I'm imagining that the same thing is true with the peptides, that it's sort of a jump start. It's not something to be relied on. The goal is to have the body to enable the body, like you said, to give it what it needs and take the offenders out of the way. So I hear you saying in the midst of the education of what do I need to keep this going into a positive trajectory?
Right.
Like I want to increase my energy,
right,
or I want to get my brain sharper. There's going to be lifestyle things that go with that. There's going to be a lot of conversations about that. But this is a way to jumpstart it, which always it's kind of like,
makes sense.
having help with the new wardrobe. Maybe
It's not, the theory of taking a drug really is, like I said, the subscription model. If you have type 2 diabetes, then I, as your endocrinologist, am going to put you on metformin. And you're going to take metformin for the rest of your life because nobody can cure type 2 diabetes. Well, that's a lie. That's a total lie. It is not true. Type 2 diabetes can be reversed if you do the work because your body is smarter than that. You've screwed it up. You've made it deaf to the signals that insulin is providing. So the answer is not give you more insulin and more insulin, because ultimately your toes are going to fall off and your kidneys won't work anymore. And what good is that? But I've made a lot of money from you because you've been coming to me for 20 years and I've always done the same thing. And I've never taught you how to take care of yourself. So it is a shanda for the neighbors. It's a disgrace that we don't teach kids from kindergarten how to appreciate, enjoy, and listen to their bodies and take care of their body. Yes.
So that was sort of a precursor to my question,
Yeah.
which is, so the synthetic is like part of what they're making at the different peptide companies. And I know, I've heard a lot of very targeted therapies, like you were saying, Jean, they're targeted and they've really helped people. Not the not the big weight loss one, but other ones.
Ozempic too.
Anyway, so
That works.
is it that they take natural substances and they add something synthetic to it? Or do we know how does our body respond to the synthetic the same way it would to the natural?
Different strokes for different folks. There are different benefits depending on what they've done and how they've tweaked it. And sometimes the natural works best. But, you know, these are outside the pharmaceutical industry. These are considered research chemicals. And if you do choose to participate, we're going to have a disclaimer that says this is for research purposes only. And, you know, I promise not to sue Dr. Roberts and all that. Of course, you know, I don't anticipate bad outcome. And they are quite safe. I hope I made that point. But there are modifications that may work better for one person than another. So we don't know yet. They're not well characterized in that way. They haven't been around they've been around for all our biology, but we haven't studied them enough to know. But there's plenty of information to get started. And then we'll be doing our own research. So I want to be testing before and after. I want to know what's happening to my people objectively. And then I have something that I can present next year for the next group. Look, our people did this well. Yes.
How long, when was peptides first discovered?
Well,
What year was they first discovered?
1913, insulin.
19 what?
13.
1913?
Mhm.
And how long has it been the advancement of where you're at today and what you're speaking about? You know,
I think it's probably.
I guess what I'm asking is,
Uh-huh.
there seems to be a big emphasis placed on this new technology, or this new discovery, or this new possibility of improving the body in many different ways. Is that correct?
It is. That's the idea.
Is that a
Is
right
it true?
assumption?
Yes, that's my whole presentation was kind of aimed in that direction.
So how many years has this been studied in the sense of where we're at today?
Well, I think you have to answer that individually for each peptide because they keep discovering more and more and using more and more different ones. So insulin was the first, and that's been around for 111 years. Pretty well studied, but not well utilized, in my opinion, because it's used like a drug, and you're told you'll never get off this. You're going to have to take insulin for the rest of your life, and that turns out not to be true in every case. So each peptide has been discovered at different times. It turns out that the Russians are the ones that are doing most of the research. And they have an institute that works on peptides and signaling molecules. And we're very new to the game, but they've been at it for decades. And there's huge amount of literature, but it's all in Russian. So it has to be translated. So my job, as far as selecting and guiding you, is to keep you safe while getting benefit for you. So that's how I see myself. I see myself not as a lecturer or an expert or somebody tell you what to do. I'm also participating, but I'm a resource because I've done the research, and I can assure you with my professional opinion that we're not going to be doing harm. Do we know everything about them? Certainly not. But they have been well studied, and I wouldn't use the ones that are brand new, crazy. I'm not going to be giving you DMT, I promise.
Can I add a couple things to that? So part of it, they've been studied a whole lot more in the last 2 decades in other countries because they aren't under the lockdown of big pharma the way we are or haven't been. And so this is not a happy subject to big pharma because it's outside of that until they can find a way that they can capture it and then it's theirs, and then believe me, they'll market it everywhere. But right now it's free and clear, which is why you have to start something like that. I will say, I did experiment with myself over the summer with Carol when she started talking about this. So what I did, it was like, can I tell them this? I got a little bottle of the semi-glutide or whatever it is for $110, which is enough for like 6 months of weekly shots. And Carol, God bless her, I'm here. She made that, she wanted that watered down bacteriostatic water to make it 1/3 the amount that was in there. And even then, after it was watered down, like by 2, I don't even know how to say that math. Watered down twice as much.
Diluted.
Made it diluted. It was diluted 2 times, fully, completely, and then only wanted me to do like 10, teeny tiny bit, once a week. I noticed a difference. And so this is why I want to talk about the lifestyle. The Vita Group's a great idea. I could tell the difference. I didn't want to eat as much. I sort of felt full already, and I love to eat. So what I did is I met myself in the mirror. Why do I still want to eat, and why am I still eating when I'm not hungry? So there's always other parts that go to it. If somebody does it for energy and they do get the jump start, if they decide they're going to sit there and watch TV all day, what are they doing? It's like we have to want our lives. We want to enliven ourselves and use this as a very safely done tool, but we still have to do our own work.
So I threw this picture in because I want you to see. This was the Department of Surgery at Albert Einstein College of Medicine, 1974 to 75.
That's awesome.
And I'm in there,
The only woman.
the only woman.
Point yourself out. Where
Second row. The second row with the big hair. Next to the guy in red, who was my husband. This guy in front was a South African cardiac surgeon by the name of Bob Frater. He was a friend of Christian Barnard. They were tight. Many of the faculty in front were from South Africa. So it was quite interesting, and it was a trial. It was a trial, I have to say. They weren't always that nice to me. They didn't go out of their way, to do anything different, and I didn't want to be treated differently. I was proving myself. So I wanted to be a trauma surgeon, but they taught me out. So I became an ear, nose, and throat surgeon instead. Because, you're going to want to have babies one day, and you won't want to get up in the middle of the night to run out. Well, it turns out I still had to get up in the middle of the night and run out sometimes, but it was worth it. But it really, again, it took me 10 years to figure out that my education was deficient. And that there was more stuff out there to know, a lot more stuff, and I'm still learning. And that's the exciting part. That's the really fun part. So Susie and I both took the semaglutide for a few months. I took it low dose also because I had heard that it's good for autoimmune disorders. And I have a tiny patch of psoriasis on my thumb, which devils me all for years. It's been a bother and nothing seems to get rid of it. But this did. So I've been off it for a while now, and this is not coming back. If it comes back, I'll do another shot. So, you know, I think, again, it's a tool. It has to be respected as such, but it's one of those that's on the safety spectrum near the top. It's pretty safe. It's when you get into overdose territory that things start to get nasty. And that's why Ozempic is not the best way to go. It's the same peptide, but it costs you 10 times as much. And it can have serious side effects. So, yes.
Question. I love the idea of the club.
Mhm.
But the thing that comes to mind is something that you said afterwards, that you would want to have the hormone element replacement set up first. And
It's
then
not
start with the
mandatory.
peptides?
It's not mandatory,
Okay.
but it makes everything better. You know, so I would want you to clean up your diet also. I would want you to exercise. And that's part of the program, is to be cheerleaders for each other and learn to do it as a habit. You have a question.
Being a breast cancer survivor, I've been told that estrogen. Just what are your thoughts?
There's been a lot of research on that topic. And in fact, several of the hormones are anti-cancer, very, very helpful, and can improve the quality of life of the cancer survivor. Who was saying that they have an elderly friend, the mother, yeah, it was a patient who did today, who's now on 4 different antidepressants. She's 89 years old, and she just wants to die. I said, go and buy her a tube of progesterone, rub a little progesterone on her arm every day, and get rid of the antidepressants. So they have been taught a line of baloney, to be kind. And it is no longer up to date thinking. But you do have to have the courage to ignore what this doctor is telling you and go with what sounds right. Nature, God, the universe, whatever you want to call it, did not make a mistake by putting estrogen in our body. The mistake comes when a plastic molecule sits on your estrogen receptor and tickles it in a weird way, or a heavy metal, or a pesticide, or any of the 80,000 chemicals that are in our environment that we don't know what they do in our bodies. There wasn't cancer 150 years ago, not like there is today. Today, you can expect to get cancer. That's shocking and disgraceful and is wrong. And it's because some greedy companies are feeding us a lie. So that's a conversation. I actually did a module on hormones. I have a very dear friend who is a breast cancer survivor, who also is a hormone expert and teaches doctors all over the country. And she is on hormones and has been for 30 years now. So it can be done, but it has to be done properly and not by one of these people that doesn't know what they're talking about. They are parroting the party line. And the party line isn't true anymore. So again, I'd like to go with nature, give nature the benefit of the doubt. And if you're prioritizing the cancer over your dementia, that's probably a mistake too, because the brain is a hormone dependent organ. And like I said at the beginning, prevention beats rescue. So maybe not all the hormones, maybe just the right ones for you, but they can really improve, enhance your life. There are hormone receptors on every cell in your body. Is that a mistake? Did that mean to be ignored after menopause? No. We have to find the right way to do it that's safe for you and monitor and make sure that it stays safe. So that's my answer. It's complicated. And I would never require hormone therapy for anyone, but I want to offer it. And the hormone therapy has to be done one-on-one for obvious reasons. So, but you don't have to do it to get into the peptide part.
I just wanted to offer something. I don't know. I could be wrong, so tell me if I'm wrong. But you asked about synthetic drugs versus a natural thing. And I heard long ago that, like chiro for chiropractor, chiro with hand, that it's like you have a left and a right glove. And when you have an artificial substance, that it's, you know, like you got the wrong glove.
Oh, yeah, yeah. They call it extra.
The chirality.
Doesn't fit right.
Exactly. Yeah. Yeah, it's in the ballpark, but not exactly right.
Yeah, that's why we had to take D-ribose instead of DL-ribose. Anyway, yeah, you're right.
And
I'm sorry.
aren't hormones just another name for information substances in your body or neuropeptides? They're interchangeable.
Not really. They're a category of messenger molecules. And the steroid hormones all start with cholesterol. So we've been taught to fear cholesterol and to wish it away and to take drugs to force it down as low as possible. So I've told this story before, forgive me if you've heard it 100 times. I had a gentleman and his wife come into my office a number of years ago. He used to be a college professor, and now he couldn't even remember his name. He was completely demented. They had brought his recent labs, proudly showed them to me. He had a total cholesterol of 98. You can't make cells with that low of cholesterol. You can't, your brain needs cholesterol. So I said, oh, does your doctor know about that? Oh, yeah. So I said, well, let me talk to him. So I asked for his number. I called him. I got him on the phone. I said, excuse me, sir, are you aware that your patient's total cholesterol is 98? This was a cardiologist. He said, yes, and that's where I want it. Slammed the phone down, and they never came back. So you don't always get the right info because they don't see beyond their body part. They know nothing about the gut. They know nothing about the microbiome. They know nothing about, the kidney if you're a heart doctor, or the left big toe if you're a right big toe doctor, and they don't talk to each other. And it's a very compartmentalized because each silo has its own set of drugs to sell you. And nobody is looking at the interactions or how many drugs you're on. You remember seeing people come in the emergency room or whatever with a list that long of drugs. And they're faithfully taking them every day. And they're wondering why they're getting weak and dizzy and they can't stand up anymore and they're constipated or they're diarrhea or whatever. Things are going wrong and nobody is supervising the program. So I'm a holistic doctor. That means I look at everything, not just your physical well-being, but your mental well-being. If you're not happy, you can't be healthy. If you're not healthy, you can't be happy. So it's got to be an interplay, and we have to find the right thread to pull to make the tapestry fall into place. It's a very different kind of philosophy. You will not get it from the average doctor. You may not even get it from the average functional doctor. So now they're calling it functional medicine, which I like and I don't like, because it is about maximizing your function. But the word functional in medical school is used to mean, oh, it's all in your head. It's not real, you know. So if there's not a blood test for it, it doesn't exist. Am I right? Yeah, so it's a crazy mixed up system. But now you know the secret. Your doctor doesn't know everything. And if he thinks he does, and if he tells you he does, then his ignorance is only exceeded by his arrogance. So you can find another doctor.
And to be fair, although a lot of them very, very good people, would be very well meaning, they're the only tools they have in their toolbox. And they're not allowed to go outside that toolbox. Right now, so many of the different practices are being bought up by bigger companies. It's all kind of going into one. What they're allowed to recommend and what they aren't is done by that corporation of medical practice.
And the
Not by
insurance
that medical
companies.
box.
Don't think the insurance companies aren't in on it. They're making money hand over fist.
Right.
You know, I differ with that. I had a
It
choice.
is the whole truth, but it is part of the truth, and I don't
It
think
is.
everybody goes to.
So most doctors are the kind of people that answered every question the way they were supposed to from kindergarten on. I fell into it late in life, and I was a human being before I was a doctor. So I kind of never forgot that. And so to me, what's right for the patient is what I'm going to do. So I'm wondering, why aren't we seeing doctors being thrown in jail for treating women who are bleeding out in front of them? I wouldn't stand there and watch that. I wouldn't send her home. No way, excuse me. I would do what I'm trained to do and go to jail afterwards and talk to the ACLU or whoever it is. When I'm sorry, we can do what we know to do, but we don't because we're scared, because there's too much peer pressure and there's too much this and that. And you might lose your license, you might lose your board certification. So yeah, there's a lot at stake here, but it's people's lives.
Goes down to human greed.
It does.
Does.
And control. And control. So the doctor wants you to think. They teach us. Your patients want you to know everything. And if you don't, just pretend you do. Because they'll feel better about it. So what thing to say? I think if I get to the end of my knowledge and I tell you, well, I don't know that, but I can go learn, I can go find out, then won't you respect me more when I say that I do know?
Well, I do respect you in saying when you first spoke that this was kind of like you, I think the word you said, guinea pig. And to me, that was very honest. All right, that this is an experience and it took risk for you to speak that. So I really respect that because it's that integrity.
It is the truth. Every patient is a new world. And every patient is, in a sense, a guinea pig. Because what works for you may not work for you or you or you. And I have to be the judge of that and help you navigate. But you, I always tell my patient, you're the captain of this ship. I'm part of your crew. And it takes a team. Life is a team sport, my son likes to say. But who's the captain? I'm not here to tell you what to do. I'm here to offer you options, teach you what I know about it and what's my experience. And I've been a doctor 50 years. That's probably worth something, you know, but it's not everything. And if it doesn't work for you, then I'm wrong and I'll admit it. So it has to be a back and forth. It has to be a team effort. So that's all I'm saying. And this I love.
I don't get it, and I have chickens.
I don't get it, well,
Get it in chickens, so do I.
so chickens are the closest to Tyrannosaurus Rex
Oh.
that are
no.
alive on the planet today.
Yes, they are little.
I didn't know that.
Yep.
I didn't know
You
that.
know, they think that dinosaurs have feathers.
I thought they were pterodactyls.
They think, well, they had feathers.
They are
Dinosaurs
like
did.
pterodactyls.
Some of them did.
Wow.
So they really are the precursors of the bird.
And they lay the one perfect protein, an egg.
That's right. Perfect food. Okay, so that's what I was talking about. And the fees are going to vary depending which peptide we're using. So I haven't quite worked that out yet. But I think for a 6-week course, I'm going to charge a basic $300, which hopefully will be more affordable because it costs $400 for the whole 6 weeks, but not with the medicine. The medicine will be extra. So it's $400 right now for an hour of my time. On January 1st, that's going to go to $525. So make your appointments early. Yes, Jean.
Is it that, or do the peptides work better if you've had some sort of detox?
Good question. I don't know. I don't know. So some of you do things like that, and others of you don't know what she's talking about. So we're all levels of understanding. Yes.
Thank you for everything. So with the 6-week thing, their cost, would that include the hormone thing you were talking about now? I have a question, because I also had breast cancer, and I was told I was triple negative, which means I didn't have the receptors. So would I not even be a candidate for the?
Your cancer didn't have the receptors, but your body does. The normal
I
cells.
never understood that, but yeah, so that's.
So that they characterize breast cancer as, does it have an estrogen receptor? Does it have a progesterone receptor? Does it have,
Oh, so my.
your cells did not. So they were actually the least normal of any kind of breast cancer, because if it has a receptor, it's in contact with the information that's coming in. If it's triple negative, it's not, it's doing its own thing.
That's what they said, it's just random, yeah,
That's right. How long ago was that?
2018,
Okay, good. So you're pretty far out.
yeah.
Did you get Keytruda? Did they have it?
I didn't get any after, I just did the chemo, surgery, radiation route. And
You
then,
did the chemo first, so you probably did get Keytruda.
oh, okay,
Yeah.
I know someone that they take something for the rest of their lives. I didn't have that because I'm triple negative, so.
Right. Yeah, no, I'm not trying to tell you.
So would I be a candidate for the hormone? treatment?
Yes. Yes.
That's what it's on.
Yes, in the back.
In my younger years, I used to fast quite a bit. And what's your thoughts on fasting as I've aged? And due to life circumstances, which life has a way of teaching you what it wants to teach you. What are your thoughts on it? Because I thought, I mean, I fasted for 13 days.
Well, more power to you.
Well, it's called a fast.
I'm not a fan of that. But in the wild, when we were foraging for food, we didn't have a refrigerator loaded with anything we wanted. We couldn't get up in the morning and start eating and finish eating as we lay down to sleep. So it is very physiologic. It makes a lot of sense to spend some time with an empty stomach. But I don't think 13 days is a very good idea.
Well, actually, I saw my addiction in that process. And I was in a recovery program that my sponsor brought it out. It was called the Master Cleanse.
Okay.
Okay, and it was a 10-day fast, and then you have to slowly start reinitiating the food. So the energy part was actually it would take whole 8 ounces of salt water. The salt water is the same it's the same, I don't know, there's
It's
something.
like
that-
ocean water.
Yeah, and when you drink it, and then you just flush it out, it just cleans your body, man. And then, from there, the energy part of it was lemons and,
Maple syrup.
organic.
Right, I'm familiar with the master cleanse. It is very powerful anti-aging tool to do intermittent fasting.
So it's healthy, like a day, maybe just not eat.
Yes.
Or eat just,
Yes, or time restricted eating is another way to do it. So you only eat for 8 hours in a day and you fast for 16. Or you fast, 2 days a week or whatever suits your plan. But it is the most powerful anti-aging tool that they've been able to identify. And there are certain medications and strategies to mimic fasting. During a fast, your body breaks down old cells that aren't functional anymore. During the eating period, we're building. So it has to be that cycle of birth and death. We grow, then we contract, then we grow again. So fasting is a power tool.
thank you.
You bet.
And if you're offering the group, do you have in mind a day, time, and place?
Okay, so I'm thinking Wednesday in the morning is a good time for me. Or afternoon, if it's better. Wednesday, I'm here. Thursday, I see patients all day, so that's not a good time. But any other day, I would be willing to do a class. So if there's more than one, I think it should be 10 to 12, no more than that. And then bud off a new group. But if it's us, we could form one group with the people here.
With the group, when we choose different peptides, like we don't all have to do the same peptide.
No, I think, I'm thinking it would be easier to all do the same peptide, but it may not be practical. So I think I'm going to have some written information, and there's going to be a menu with a small description of what each of the peptides do and the pricing. And then when the information comes back to me, we'll set up the groups accordingly. And it may be fine for one person to be doing weight loss and another to be doing cognitive enhancement kind of thing. Why not? We're not all the same. And I certainly don't have enough groups to be doing just one thing at a time.
Like, could you do more than one peptide at a time? Or do you suggest just one and see how that goes?
I think in the beginning, one at a time is a better idea because it's too confusing, too many variables. Yes.
I'm on semaglutide already, so I would not be eligible for this.
Well, yes, you would pick a different peptide. And then I could talk to you about how well is it working for you. How well is it working?
Good.
Yeah. You don't have side effects?
I'm sorry,
You don't have GI side effects? How long have you been on?
not long, about 6 weeks.
And what have you seen so far?
I've lost about 10 pounds.
Excellent.
She has me on a really low dose.
Good.
And it's the kind I sell.
You administer yourself.
I draw it on myself, yes.
Good. So you're in control of your dose.
Yes.
Good. I would keep it at that dose as long as it's working.
Mhm.
Because the protocol is double it every 4 weeks.
Mhm.
And that's when you get trouble.
Right.
So yeah, I think we could mix and match and just kind of do one for a while. And if you like it, do it again later in the year. I don't know. I haven't thoroughly thought it out. That's why I wanted to bring it to you guys and see what you're thinking.
Yeah, and just thinking this with you, different people would have different needs.
Yes. Right. So again, the hormones, I believe, are super important for maintaining your body, maintaining your energy, and maintaining your brain function. If you don't want hormones, if you're scared of hormones, of course, we won't do them. But going on hormones is not a requirement for the group, but it might get you better results. So that would then require a one-on-one visit with me, because hormones are prescription
Does
items.
it take hormones?
Excuse me.
How do you get the hormones? Is it one off or you take it weekly or monthly? How do you?
I like to give them once a day, either a topical cream, a vaginal suppository. Those are the ways I like to do them. Swallowing hormones is not a good idea in most cases. It's swallowing the hormones, oral versions. The liver does funky things to anything that comes in. It denatures it. It can, if you do estrogen that way, as in birth control pills, you run a big risk of clotting. It increases clotting, and then the hormones are changed by the liver, so you're not really getting what you think you're getting. So there are better ways to administer that. Well, this has been a lot of fun, ladies.
It's been wonderful.
And,
Thank you.
So we have one more month in this year, being the month of December. I don't have anything planned. If you would like me to do another talk, or if you just like to get together and pick my brain, then we can do another one next month. Otherwise, I'd like you to take down the number, sign up for the peptide group, even if you're just questioning, if you're just modestly interested, and then I'll send you the information as soon as I put it together. How's that? What is your name?
My name is Janet.
Janet.
Yes.
How do you do?
My question is, all my life I've been very alternative. And, but I am an addict, and I come from a family of addiction. And so I'm not that I, with food or yo-yoing or whatever. I have an interest in my aging process. I'm on medication. And my whole life I've never taken medication. And it was very humbling to actually start being on. I mean, thyroid, the thyroid was the beginning first one. And it's like, I'm gonna get off this. And it was like the attitude of the nurse, the doctor was, I'm gonna never get off. And I guess I maybe started to believe that. And then from there, there's a heart medication, and I really would like to get off that.
So what I'm not going to be doing is individual counseling like that. That you really would need to be my patient if you want my advice about getting off meds. That's not the purpose of the group.
Are you that kind of possibility, or are you not that kind of
I am 100%.
You are that kind of.
I am that doctor, and I will tell you if I think you need it. But I will also tell you what I think you might do to get off it.
Okay. Yeah, because I do have a history.
And thank you for your courage, but everybody in this room is addicted to something.
Well, and never, all my life, I judged other people that were. And in that sense, and in that light, especially my sister that actually died of addiction. God has, the universe, God has an interesting way of bringing you where you need to learn and what you need to learn to do. 71.
Very young, 71.
Well, I think my heart is young. My little girl is young.
Your face is young too.
Thank you.
I can't see the rest of
I
you.
just know whenever I was invited, it's like, oh, yes. I wanted to be here.
Good. So something brought you here.
Yeah.
So we've already started our little support group, haven't we, ladies? And I'm glad that it's all ladies, not that there's anything wrong with men, but they think differently and they act differently. And they're much harder to deal with. So I wouldn't run a men's group.
And I checked you out.
And you check me
I
out?
checked you out.
Oh, boy, and I didn't know anything. Okay, well, apparently I passed. So there's a purple basket on the table, which is intended for donations. I give a donation to the Humane Society of Sarasota every month, just because I love the little doggies and kitties. If you found anything of value here, just pop something in the basket.
So what happened to Lazarus?
Oh, Lazarus is living in Lazarus is the squirrel that my son found dead on the grass. We thought he was dead about probably 3 months ago, maybe 4 by now. And his eyes weren't open. And so I took him in and started feeding him. And lo and behold, he grew up. And then I introduced him to the outdoors gradually. And then I became more and more trusting that he could handle it. And now he lives out there, but I go out in the yard and he comes jumping on my head.
Yes, that's good.
Yeah, yeah.
Maybe ask how old you are.
Oh, yeah. of
I'm
course.
sorry, you can say no.
That's a great question, and I'm not ashamed, but I want you to pick a number in your head before I tell you. So I'm 78. I'll be 79 in February.
Thank you for your honesty.
There's no point, right?
Yeah.
We don't learn from life.
Where do we sign up? Or how do we sign up?
Those 2 young ladies at the table there in black, they are my staff.
If you are interested in the peptide class, if you can send an email or call that phone number and just let me know that you are interested in it. We are still in the infancy stage, so we're still working out the logistics, the costs, the ordering, all of those things. So we are currently in the wait list phase. We would love to take your information, put it down, talk about the wait list, and as soon as we're actively scheduling the groups, of course, we'll reach out. And let you know.
And we definitely have a December meeting. We're just not sure of the topic, or it might be a topic that everybody just ask questions kind of thing, but definitely December 4th is the next meeting.
That would be true. So this is Lazarus, and it's supposed to be a video
Oh, that's adorable.
after the storm. Yeah, he's so cute, and he's getting handsomer every day.
Aw.
So cute. Awesome. Thank you, everybody.
you.
This was great fun.
Did you sign?
Yes, ma'am, I will.
Thank you.